Trans activists are trying to promote the idea that there is a normal transgender pathway to adulthood, that children who are transgender should be identified as young as possible so they can be aided in their medical transition, so that it makes it easier for them to be adults because they won't have to deal with medically transitioning after going through normal puberty. So basically what they want to do is they want to go into schools and promote the idea that being transgender is normal, and that a child who has gender dysphoria is a transgender child, not a child who has a mental health issue. And that in order to help this child, we should start the process of socially transitioning them and then medically transitioning them to prevent them from ever developing normal secondary sex characteristics, and therefore prevent them from having any anxiety about those secondary sex characteristics when they grow up into adulthood. This is kind of a complicated idea, but there are kind of two different ways of looking at gender dysphoric children. As a child who is gender dysphoric, I have a very strong stance on this, and that is that gender dysphoria is a mental health issue and should be treated as such. But some transgender advocates suggest that gender dysphoria is actually the result of a child who is born in the wrong body experiencing distress because they're not recognized as a trans person. And so the best approach would be to accept transgender children in as early as possible, really. And the idea is to go into schools and educate children about what it is to be transgender, so that transgender children can be identified and be put on that path towards being a transgender adult. For a child who is grappling with how well they fit into gender stereotypes, or who perhaps has developed gender dysphoria as a result of an underlying issue, telling a child like that they in fact are transgender and should medically transition as soon as possible is going to be incredibly dangerous, especially because medically transitioning causes a functional body to become dysfunctional. There's no other case where we screen children to put them on a trajectory that will make their bodies less healthy. That's what medically transitioning does. It causes a healthy body to become dysfunctional. It pushes a girl to develop as a boy, or it pushes a boy to develop as a girl. This is in no way promoting function. It's promoting the idea that there is something wrong. So a child who is gender dysphoric, rather than trying to help that child resolve their dysphoria, transgender activists want to go in and reinforce that dysphoria so that the child believes they need medical attention because they were born in the wrong body. We also are going to be telling children who don't have gender dysphoria that at any point, if they feel like they have discomfort with their gender, that perhaps they're transgender too. It's possible to be loving and supportive of the adult transgender population without trying to convert gender dysphoric children into transgender adults. And that's what this is doing. It's converting gender dysphoric children into transgender adults, rather than trying to help that child understand their gender dysphoria and resolve it. It's encouraging children to believe there's something wrong with their body, something so wrong that they need medical treatment for it, something for which the sooner they get medical treatment, the better. This is not a narrative that is healthy, and it also doesn't promote tolerance. What it does is it promotes more rigid stereotypes, because it suggests that only children who act in stereotypical female ways are girls, and only those who act in stereotypical male ways are boys. It actually reinforces gender stereotypes and encourages children who don't adhere to those gender stereotypes to develop gender dysphoria and believe that they are transgender, when in fact they're not.